Right. Thank you. Welcome, everyone. Thank you so much for giving us some of your time today. We are the Capacity Collective, and we're here to talk about BSK's new culturally responsive measurement tool. We call it the CRMT-PF, and that will be explained in a minute why we do that. Just a quick note that we would like to thank Best Starts for Kids. Thank you, BSK. This work is made possible by King County's BSK levy. So thank you all so much. Let's jump in. I'm here with my wonderful colleague, M. Carr. I will introduce myself first. I'm Meredith Williams, and I'm the Director of the Director of Operations. Before starting the Capacity Collective, I was a professor of sociology and criminology for about a decade. And we started the Capacity Collective almost 5 years ago to bring all of those tools and skills and experiences that the collective of us had gathered in our work and academic and professional lives. And we decided to get together and use those things to work alongside community organizations, especially those that have been under-resourced, so that they have access to data and have access to data people to support their work. Em, do you mind introducing yourself?
Hello, everyone. I am M. Carr. I use they, them pronouns. I am a senior project manager at the Capacity Collective. My background is in nonprofit work, specifically working with young people, doing case management and home visiting. I've been working on this particular project for 2 years, and I'm very passionate about it because I have administered a lot of assessments and have a lot of feelings about them. So it is exciting to be able to work with service providers to try and design a tool that will hopefully be very helpful to them and feel good for families. And I will be monitoring the chat. If you have any questions or any comments and you don't want to say them aloud, you can drop them in the chat and I will happily read them aloud or answer them within the chat.
Great, thank you so much. And I'm so sorry that it isn't a long enough session to all introduce each other, but hopefully you'll have a chance to say hi because you probably all know each other by now. But this is our plan for today. This is our roadmap. We're going to talk a little bit about the deficit model and protective factors as the sort of anecdote to that, or the antidote to that. We'll introduce the tool, the CRMT-PF, and talk about the background that got it to where it is. We'll talk a little bit about who should use it, where it might be a good fit, and what the next steps are. And then hopefully we have a few minutes to answer any questions that you may have. So we're going to start with a quick poll. If you work inside of an organization, what assessments do you use? If you are a funder, what assessments do you encounter or do you require, perhaps? So Em is going to put a poll up for everyone to take a look and select all that apply. We'll give you just a moment to fill that out. I kind of figured the ASQ would be one of the higher ones, right?
Looks like we're still getting responses in.
Yeah, interesting. 75% are ASQ. Preview them.
And I see in the chat that we've got the SWYC and MCHAT screening tools. I'm actually not familiar with those, Juliet. So if you want to add anything else about them in the chat, I would love to hear.
Yeah, interesting. Talk about acronyms, huh? So funny. Great. Looks like it's slowing down a little bit. So should we show the result? Yeah, so more than 3/4 of you are interacting with the ASQ, and that is the Ages and Stages questionnaire. So that's tracking kids' development. The ASQ-SE, the social emotional development of kids, more than half of you. Another common one being the Piccolo. We definitely hear about that a lot. And I think the RAT, which is maybe not the best named assessment I've ever heard of. See that a few people are using that one. And then, yeah, really interesting that there are so many others. So thank you so much for that. Yeah, the reason that we wanted to talk about this is y'all give a lot of assessments, right? And assessments can be great. They can be so helpful and so powerful for learning about the people you're working with, the communities you're serving. They can be great. It helps with early intervention. It helps with seeing where families are when you're meeting with them. And they can also be a little tedious. They could be a little tedious for staff. Let's not even say little. They could be pretty tedious for staff and for families. They can be repetitive. And survey fatigue, especially we're in 2023, people ask you everything via survey all the time. And it's called survey fatigue, and it is real. And it's a good chance that when people are receiving services from you, or they have received services, or they will receive services in the future from other organizations, they're probably doing a lot of the same assessments or others, and it can really cumulatively be a lot. And a lot of assessments have come from, let's just own this, white-centered research done by white academics, because academia has really been dominated by upper-class white folks for so long. So not all of these assessments have been tested on non-white communities or cultures that are not the sort of dominant culture of the United States. And rarely have a lot of these assessments been tested in languages other than English. And the focus has been on statistical validation, which of course has its pros, but it also has its cons. It's this method of validation that comes from academia, which is the same white-centered space. So some of our assessments that we're using are really steeped in these white middle class or upper middle class versions of what's normal, or what makes a good parent, a good family, or even what makes a good survey. And there's a cumulative effect of all of these assessments, survey fatigue, as I said, but it's also answering questions again and again about things that are wrong with your life or hard about your current situation. A lot of it really focuses on the negative, and it can feel extractive. We'll give you these services, but we need your sob story. And I think that can feel a little icky. The deficit model is all about that. That's the cumulative impact of being asked again and again about the negative aspects of your life. It comes from this underlying belief that some groups are starting from a place of deficit because of individual flaws or cultural weaknesses. And over time, it builds this association between some communities and negative attributes. And rather than focusing on the systemic root causes of these issues of being under-resourced, it starts to look like there's a deficit in some communities. And it's also, when you're taking these assessments again and again, it's providing a hidden message. We associate your community with problems, with struggles, with risks, and not that there aren't very real equity issues and very material issues, but that's not everything that defines any community. And it's hard for people to feel psychologically safe or feel like they're being seen as full, complex human beings with hopes and dreams when they're constantly being boiled down to problems and risks and negatives. So in isolation, we think, well, okay, this assessment is really helpful. This is going to give us great information. We really need this for early intervention. Yeah, absolutely. But I would ask you to think about the cumulative impact of all of these assessments from all of these different programs. And Em and I went and actually looked at the assessments that we had in that poll and looked, what are the questions in there? And are any of them possibly contributing to a sort of a deficit way of thinking? And these are all real examples from these assessments. I'm so good at technology. Here we go. So there's a question. I have felt sad or miserable. A question. While you were growing up, did a household member go to prison? When you were growing up, did a parent or another adult in the household very often swear at you, insult you, put you down, or humiliate you? Or act in a way that made you afraid that you might be physically hurt? Do you have any concerns about your child's behavior? Does anything about your child worry you? So those can have a cumulative effect of answering these questions again and again and again that are really focused on the negative. And I feel very fortunate to work with BSK because they have listened to the call coming from communities to say, let's use a strengths-based approach instead of a deficit-based approach. There's really been a wonderful call from communities, including a lot of the community-based organizations here in King County, to really flip that script and ask, can we please focus on strengths? Let's move the focus from what's supposedly wrong to what's strong about these communities, what's helping people to thrive. Because there's just as much to learn in that direction, if not more, right? So that has led us to really focusing the CRMT on protective factors. That's the PF in the acronym, protective factors. And by doing this, we hope to flip that script, send a hidden message that associates communities that we serve or that you all serve with their strength and their support and their systems and all the good that can come from that. We adapted a tool that we, from the Friends Center. So if you've used the protective factor survey in the past, this will be familiar to you. It's adapted from that. But it's based on this definition of protective factors. Protective factors are conditions or attributes in individuals, families, and communities that promote the health, well-being, and resilience of children and families. And I will say that we did all of this work with advisory councils that have said that they don't, some folks have said that they don't love the word resilience. And so just know that we are going to be using that word a few times in this presentation, but it'd be good to think about, other options for that. And of course, that definition comes from the Center for the Study of Social Policy, and it's all based in the Strengthening Families framework. And these are the protective factors. How they have been defined and how they've been measured has evolved a little bit over time, but these are the ones that we use in this particular instrument. Family resilience, which is, again, perhaps there's a better phrase than family resilience. We're working on that. But it's those adaptive skills and strengths that families have to persevere through challenges. There's knowledge of age-appropriate parenting and child development. There's looking at your social support, those families, friends, but also your community who can support your emotional needs. But that's not enough without concrete supports, right? Those tangible supports and services to support families with their financial and material needs. And there's the relationship between parents or caregivers and program staff. And all of these have been really well established in the research to correlate with positive outcomes for families. So again, why measure problems when you have this opportunity to measure the strength that families and communities have? So BSK contracted with us, we're now 3 years in, to develop an alternative to these assessments, or at least a complement that can be strengths-based, right? And they wanted a tool that could measure protective factors rather than those risk or negative factors. There are a lot of words packed into this description, the CRMT-PF, culturally responsive measurement tool, protective factors. So let's break down what this means. First, as we've been discussing, there's this deficit model issue, but there's also an issue of assessments not necessarily being culturally responsive. Probably first community-based organization I met with, the first thing they told me after the introductions was, we don't like using the ASQ because it makes these assumptions, for example, that children should be able to hold a fork. We serve communities that the kids hold tortillas or flatbread or something else. A fork isn't culturally responsive. All right, that made complete sense to us. And we immediately started like, okay, well, how can we do it better? How can we understand that? How can we think about this differently? And if we did a deep dive into what it means to do culturally responsive research, and if you're interested in that at all, we have made an Empower tool. That's what we call our free handouts. So I'm actually going to have Em drop a link in the chat if you'd like to see kind of the details of culturally responsive research. But generally, if you want your research to be culturally responsive, you need to come at it with an approach of co-creating knowledge in authentic partnership with communities so that can incorporate cultural norms and values. So we'll talk a little bit about how we did that. Yeah, that's what we mean by culturally responsive. And it's a measurement tool. Okay, so what does it measure? It measures the caregiver, and that could be a parent, that could be a caregiver, that could be a foster parent. It has been tested with foster parents. Their perception of their family strengths. It also measures their knowledge of parenting and child development. You see these align with the protective factors. It slowly measures family social support system. So as a family, what are those social supports that you have? And what are the concrete supports that you have? And it also gives you an opportunity to measure what is the relationship that the family has with the staff they're working with in your program. It also measures demographics, or it allows people to self-identify along several measures of demographics. And very slowly, I'll tell you, my last bullet point here. Yeah, that is really slow, so maybe not. All right, so it measures demographic and family structure. So it allows you to see, is your program working the same for single parents or teen parents versus parents or families with two parents or parents with out-of-home care going on. So it allows some flexibility to be able to measure those things too. And so what is it after all of this? If you haven't pieced it all together, the CRMT-PF it's a tool for measuring protective factors. But what we also have found by actually working with families and getting feedback from families and staff is that it's a great conversation starter. It gets people talking about just realistically what's going well in their lives and where they want to maybe work on something. It can act a bit as a needs assessment. It can kind of give you a place to understand, well, how are people's support systems? Does that mean as a program, we need to do more community gathering so that we can build up those support systems? It can also give you a pre and a post test, or you can use it as a snapshot. You can see, where are people with their protective factors when they start your program, and where are they 6 months later or a year later, depending on the length of your program. We have an implementation guide that can give you some sort of support or guidance on how you would want to use it. Or you can use it as a snapshot. This is where people are today, especially if you have a shorter program. And it's community co-created. We had 2 years of what we called, and self-named, the Resilient Families Advisory Council. And people on this call have been highly involved in the RFAC, as it was called. It was by meeting together and vetting and wordsmithing and gathering feedback from families. It was co-created in, I would say, the best advisory councils I've ever been a part of. Just what great people came together and really thought hard about what would make an assessment like this work in their communities. We use the principles of culturally responsive research to guide us. And while we also did a statistical validation last year, just to make sure, we also did a cultural validation where we did what we found to be a rigorous version of testing in community and got a lot of feedback. The CRMT-PF is 30 questions, and it's meant to be modular. If you work with families on a particular 1 or 2 or 3 protective factors, but not all of them, you could give it in sections rather than the whole assessment. So it's meant to be modular. I think that it's probably great altogether, but I might be biased at this point. So here's what it looks like. And this is just the paper version, if you want to be able to download this or to see it better, because I know it might be a little bit hard to see on our screens, Em is going to drop a link to a page of our website that has all sorts of resources and downloads, including the tool in other languages that we'll talk about in a second. So please help yourself to anything on there. That's all available and gives a little bit of the background. And yeah, so this is what it looks like. I'll note right out of the gate that it starts with an introduction script based on feedback we heard from the advisory council that the instrument needed some framing. People, and I think this is such a great concept for all of our data collection, that people want to know why you're asking and what you're going to do with that information. So this provides a model for how to frame something like using an assessment like this. Then there are several questions that collectively together help measure family resilience. And these have all been tested and community validated. Then there's a section on knowledge of parenting and child development. Again, those all got culturally validated. And social supports. Again, those are those sort of emotional family friend supports. Then there is another framing, because we, like part of a script, because we heard feedback from the advisory committee that when families were asked about places where they were having trouble affording something, then, or actually, so I will back up to say, one thing that we heard from the advisory council is that people take these assessments in a place of fear. Not this one specifically, but all assessments, that perhaps this information would be used to call CPF or somehow get to them in trouble, right? And so there's a lot of framing to be very transparent about how the data will and won't be used. So when there are questions about what can you afford, we're also being transparent about this isn't a promise of services. This is taking a snapshot about what families in King County need. So there's the script, there's concrete supports, there's a little bit more framing, and then there's the caregiver practitioner relationship. And again, you can download this and see all of this, or you can take the online version. This is the demographics page. And so it's information about the participants themselves, how they identify their gender, how their age, their family structure, all those sorts of things. And then we have a really expanded demographic so that people can self-report and be as specific or non-specific as they want. And we added Indigenous identities for all categories, hearing from the RFAC that, you know, Indigenous folks are not just from what is considered currently North America. There are Indigenous folks all over the world, and proudly so, that maybe the borders around you aren't as important as your Indigenous identity. So there is the opportunity to self-identify in that way throughout. And then there is a non-client facing section, which is where you can collect program information, especially if you want to be able to make comparisons over time or something like that. It's an optional section, but if you want to be able to measure things as a program, then you have that section. All right, so let's talk about how the CRMT-PF came to be, the background of all of this. The project really started with these three goals. First, to develop a tool that was culturally relevant and multilingual, and specific to these families. To develop a tool also that can be used to measure the impact of community design home-based services. If you are working with a model, there's already sort of been some research into those types of programs. This gives you a chance to do that kind of research. Hey, how is my program working without having a model? So that it's better for community design programs. And it was this opportunity to demonstrate that culturally responsive evaluation methods are possible, even in these big publicly funded initiatives like BSK. So the folks from BSK that have been working with us on this have presented, and we've co-presented, and we've had RFAC members co-present at various conferences to sort of show a model for how this can be done and why it's important. And this was the overall timeline. And I really want to emphasize that this instrument started with community conversations. We started working with BSK funded programs, and we heard again and again these issues with assessments, especially that they were not culturally responsive. And we were helping programs measure, okay, what cultural adaptations are you making? But they were also talking to their program managers at BSK and saying, hey, this isn't a good fit. This isn't going to work for us. And so because of those community conversations, we're now in year 3 of creating an alternative to that, where we were actually able to co-create a community-based tool. So as mentioned earlier, the CRMT was adapted from the Protective Factors Survey, version 2, the PFS2. And it was selected because it was the one that was best in line with the Strengthening Families framework. And it has been tested as being easy to use. There's a self-report format, and so people can talk about their own lives instead of people making kind of subjective judgments about people's lives and interactions. And they have always had the intention of measuring these universal family strengths. So we wanted to build on that. We did some deep dive into research on culturally responsive research, what else is out there for measuring these protective factors. And the survey itself went through numerous rounds of adaptations and validations. We had 2 years of advisory councils, and those advisory councils were made up of home visitors, program coordinators, program managers, directors, all sorts of people who are all sorts of practitioners working in the field. We pilot tested the survey in English, not just for validating the language, but also the implementation process of it. And we got feedback on that informs our the guides, the implementation guides that we give alongside of this. And we then went into the instrument's been translated into 4 other languages, and those are being tested right now. They're being community validated, and those languages are Simplified Chinese, Somali, Spanish, and Vietnamese. And the ask from BSK when we set this up, or when we started this work, was to really try to create an instrument that would work for these key communities in King County that the BSK funded programs are serving. So who should use it? Of course, generally, it's for programs who are serving families with children age 0 to 5. But there are more specifics as well. So we find that it's good for programs who want to measure protective factors, right? So if that is something that you have already incorporated into your program or you'd like to, it could be a good fit for you. If you want to be promoting protective factors with families, again, instead of thinking about the sort of negatives or problems, but the promotion of protective factors. If you want to track change over time, again, you could do it as a pre-test and a post-test. And if you want to use an instrument that has been culturally validated here in King County, then this could be an option. We also think of it as an opportunity to potentially streamline the intake process, where maybe you don't need a needs assessment and this and that and this and that. Maybe you could actually look at your collective intake process, especially if you went to session the other day and you're already thinking about your intake process. This might be an opportunity to consolidate. And when you want to get feedback on your program, there are some questions in there that actually can help you measure, how is my program doing? And it's great if you really want to be able to understand family support systems, so that when you are building self-efficacy, you can help provide supports in that way as well. All right, for next steps, for the rest of this year, we are still working on the community validation. We're still well into it now, and we're just so thankful for all of the amazing community-based organizations who have been working with us on this. We have made great strides with Simplified Chinese, Somali, and Spanish. We have struggled a little bit with Vietnamese, that we would love to get more data. So if you happen to be an organization that serves the Vietnamese community, we'd love to talk to you. Give us an email. And we will produce a final report on that community validation process, which will be available through BSK, and will provide some recommendations for all of the training materials for organizations who want to use this and want to implement it, so that those training materials can be culturally responsive. There will be both a quick guide and a longer for nerds like us that really want all the details about an implementation. There'll be a full guide. And we've also created a scoring tool, and that will have the tool and the guide hopefully available. And all of this will be available on the website as it comes out. So feel free, if you didn't grab that link earlier, Em can probably throw it in there again. And you can keep tabs as things evolve. Beyond 2024, we would of course love to be able to feel we did just as robust of a validation with Vietnamese as other languages. And so we're hoping that, a larger sample size. Getting those implementation materials translated. We really, based on feedback from the RFAC, feel that some live trainings will be really helpful for getting the instrument out there. And those are not going to be enough languages for this tool. I think it really needs to be validated with other languages, but of course that costs money. So if you have bags of money and you're looking to invest in cool projects like this, also send us an email. But this question here, what languages should be next? We do genuinely want to ask you that. So we have a poll for that, Em, if you don't mind launching our poll. All right, what languages would you like to see? This says training materials, but I think I didn't say more broadly.
Yeah, sorry, I just caught that. More broadly, what languages would you like to see this assessment in?
Yeah, and it's good to see that Somali what is important to folks because that was prioritized for this year. That's great. Amharic.
I see in the chat Dari Pashto, and there's a +1 for that. Yes, please.
Great.
I think I chose maybe the top couple of languages spoken in King County, but if there's another language that you are serving families in, please put it in the chat.
Great. All right. It looks like it's slowing down a bit. Should we end the poll and take a look? Yes, it looks like Somali. Good. I'm glad that was prioritized, and Spanish. Amharic, that was my guess that would probably be logical for the next round. And so good to know about the others here. Great. Vietnamese, yeah, absolutely. I feel like we want to be able to finish that up in Korean for sure. Okay. Yeah, this is helpful. If you have other thoughts about that, please, anytime, send us an email. If you want to know more about it, check out the website or ask us any questions that you have. And thank you so much for participating in the polls. So here's our moment. We have a few minutes, of course. We still have 10 minutes, actually. I spoke really fast. So are there any questions or thoughts? If anyone wants to unmute or ask in the chat, any questions about the project, about our RFAC, anything like that?
Hi, this is Juliet. As many of you know, I think about screening a lot. And so a question that I get asked several times a week are about, various developmental screening tool options. And I have not included this as an option that I recommend for people who really do want a clear snapshot of child development. But I wonder if you think I should, or where that sort of fits into the scope of developmental screening that does, branch out a little bit into protective factors and environmental factors, but, has a more limited focus, I suppose.
Yeah, I mean, I could see it being a complement much more than a replacement. And that, I mean, there is a section on parent or caregiver knowledge of child development and parenting, but it isn't going to do the assessment of, hand-eye coordination or anything like that. But I could see it being complementary in terms of honestly giving context to these other assessments for what's going on in the family life that might help you understand how, the scores and other things. And also just the bandwidth of a family to be able to respond to early intervention needs. Right? I think it can give you some nice context about what's going on with the family, and it's a great conversation starter about where can we lean into strength and how can we build on that. But for a replacement, I don't know that it would get at the specifics enough. I don't know, Em, if you have any thoughts.
Yeah, I put something in the chat about this earlier, that this is not, you know, a very, this is sort of a broader tool. And in conducting all of these tests over the last 3 years, I think the most positive feedback that I've gotten has been from community designed programs where people maybe don't have that many assessments that they're using, or they had sort of developed their own surveys or assessment tools to try to be able to measure the impact of their programs. And so having an existing tool that was community designed to measure the impact of their program and also have a deeper conversation with the families that they were serving was really beneficial to them. So I hope that answers your question, Juliet.
Yeah, and because it is modular, what you could do is say, give it as an option if people want to use sections of it for those sort of conversation starter or context building reasons. And thank you, Julia, so much for the question. And I'll say that we have a lot of people on this call that have been very much involved in the last 3 years. So if anyone else wants to say anything about their experience, of course, feel free. Any other questions, comments?
I'm sorry, I'll just ask one more question. If
Please.
programs are interested in getting started and they wanted, some background context and perhaps a training, is that something Capacity Collective is offering, or should we direct them to the website to get grounded in the work? What do you recommend?
Yeah, I think the sort of quick and easy version would, of course, be sending a link, but I would love the opportunity to just talk to people because it helps inform our implementation guide if we know a little bit more about what people are looking for and how they're understanding it to potentially be a good fit. So I'd love the opportunity to be able to talk to them about it. We don't have any formal trainings planned yet, but I think that would be great to know. And we can also take that to our program managers at BSK and see if that's something that we can work on together. Well, thank you so much. Sarah J, you raised a hand.
Thank you, Meredith. I don't want to be premature because this is something Ann and I need to touch base with you more, but if there are BSK partners who would like your support in using, understanding, implementing the CRMT-PF, if I got all the letters right, that's something that we can support through BSK capacity building. So yeah, I hope that folks do reach out to you, and BSK wants to see all this good work that you and the community have done, actually get into our partners' hands when they want it. So yeah, please do reach out if you're a community partner interested in learning more.
Thank you so much for that. I see Anne also responded in the chat, some agreement. So thank you so much for that. And Wen, you also raised your hand. Thank you.
Hi, I have been so curious, and I've been from afar knowing that this was going on and curious about it. So thanks today for sharing. Folks I work with aren't using this kind of in-depth tool. So I'm curious to learn more about it. But one of my wonderings when in thinking about strengths-based or deficit, you didn't go over like how this tool is used or scored. And as I was reviewing some of the questions, I was wondering if some of them felt more strengths-based and some of them less so, and how you managed that as you've gone along.
Yeah, there's yeah, so I would say that first of all, for scoring, and it's true, that definitely would probably double the size of the presentation or the length of the presentation, talk about scoring, but it is meant to be scored in sections, like 4 or 5 questions for each of the protective factors collectively. Those questions together should hopefully give a little as robust as quickly possible. assessment of that particular protective factor. And we wordsmithed every one of them so much with the communities about how will it best be understood in a consistent way. And also let us know if someone is just taking the assessment by just checking all the way down. It does a little bit force you to read the questions and make sure that there's some understanding so you don't just check all the way down. And so that does mean there's a little bit of back and forth between in the direction of strongly agree to strongly disagree, you know what I mean? Where you'd have to have it be a negative versus a positive in the way that you answer, but ideally still focus on a positive attribute. But there are also questions about, you know, what have you not been able to afford? And that is really negative, right? So we're hoping that with the framing of let's get an honest assessment of where families are. And we also think it would be a great practice for programs to have a response to those answers. So you're not just asking, but you have, whether you're providing the services yourself or you have community organizations to whom they can be referred to work on some of those issues, then it's ideally a little bit more holistic.
Yeah, we have some guidance in the implementation guide about making a plan to be able to support people when they, you know, are answering that they've had trouble affording something or that they don't have social supports. I know some of the feedback that we've gotten in the past few years has been that for our FAC members who were surveying families that they'd worked with for a while, it felt really celebratory to think about the work that they had done in their time together and where they had gotten. So even though some of the questions were focused on, you know, things that they couldn't afford or areas where they had trouble, it was an opportunity to reflect together on how they had problem solved over time. So another argument for it to maybe be used over time or be used with someone who's been receiving services for a while is that it can be like a great reflection tool and celebration of hard work that, you know, you've done with the families that you work with.
Yeah, thank you, Em, for those points. We've just been thinking, you know, as our team, just so much about how all of the data that you collect is either contributing to your relationship with families or potentially chipping away at that relationship, or, you know, maybe it brings up power dynamics, or maybe it brings up deficit issues. And so just thinking about all of your data as part of that relationship, when that relationship is so fundamental to the positive outcomes you're hoping for. And so, yeah, we would love for, at the very least, for people to take a look at this. How could it fit in a complementary way to contributing to the relationship that our staff have with the families they serve? Thank you all so much. We made it through 45 minutes really fast. So Em has been great about putting the link in the chat, and our email addresses are in there. So by all means, reach out if you have other questions or want to talk more about it, want to talk nerd talk with us. And otherwise, thank you so much for joining us today, and enjoy the rest of the summit. We do always ask people, if they're willing, to give some input on how you felt about the presentation today. So there is a link to our evaluation in the chat, and we'll be following up with an email with the slides and a link to watch the presentation again if you just really want to hear me yammer on for another 45 minutes about it. And just let us know if you want to talk more. Thank you all so much, and enjoy the rest of the summit. Thank you all. Bye.
Thanks, everyone.
I think we could stop the recording.